Welcome everybody to Open Classroom. It's the Brown Schools Digital Forum for community, for conversation, for learning. We are so glad that you're here. Okay, I think I've fixed my technical problems. Thank you so much for your patience. This is my first time, so I'm bound to make 14 million more mistakes. But yes, as I was saying, I'm Laurie McConnell. I'm communications coordinator here at the Brown School. Just started, as you can tell, and I am so honored to get to spend time with some of the most brilliant people. We're going to talk to social workers, public health experts, clinicians, educators, thought leaders, to discuss really vital issues that affect all of us. And today is no exception, PTSD and the COVID-19 pandemic. I'm really excited to learn a lot today. Before we start, though, I want to do a tiny little bit of housekeeping. This is a webinar format, which means that we can't see or hear you, but we would love to know your thoughts and questions. So please feel free to post them in the chat, and we will get some questions answered in the middle of the program and also at the very, very end. Also, we're streaming live right now on YouTube. So if you have a colleague or a friend who wasn't able to get registered, but they'd still like to watch it, you can send them to YouTube. In just a second, I will put a link to that in the chat. I also want to let you know about some open classrooms that are coming up. Next Tuesday, August 9th, we have another in our series on the Power of Three campaign. We're going to talk to a brilliant panel about how macro social workers are mobilizing voters. And just to note, that program is going to start at noon. Usually it's a 12:30 start. That one will be at noon. And then Tuesday, August 30th, we have a great program on helping young people thrive in the school year. We all know it's been a tough few years for students. So I'll also put a link to our open classroom page in the chat so that you can look at that and get registered if you'd like. But now for the main event, PTSD and the COVID-19 pandemic, we are so lucky to have Dr. Megan Keys. Dr. Keys is a licensed clinical psychologist with expertise in the clinical assessment and evidence-based treatment of PTSD in adults. She has more than 20 years of experience providing clinical services to trauma survivors. Since 2008, Dr. Keys has worked as a clinical consultant with VA National Center for PTSD's Prolonged Exposure Therapy Training Program. Dr. Keys is also an adjunct faculty here at the Brown School, where she teaches a graduate level course in cognitive processing therapy, as well as continuing education workshops for the professional development department. She is the founder of Trauma Empowered Consulting, which helps organizations better understand the impact of trauma and of stressful life events on clients as well as employees. So thank you, Dr. Keys, for being here. I'm going to hand things off to you.
All right. Thank you so much, Laurie. I really appreciate it. Okay, y'all, let me just pull up the slides and we'll get started. Okay. All right. So hello, everyone, and welcome to Open Classroom. Thank you so much for joining us today. Trauma and PTSD are sometimes difficult topics to discuss, so we really appreciate your willingness to spend this next hour with us in hopes of learning a bit more about these issues. Although I won't be able to view the chat box during the webinar, please feel free to interact with each other while I'm presenting. You are more than welcome to post questions, reactions, or share resources. I really want us to optimize this time together in terms of connecting and learning from each other. All right, so this is our agenda for today, and the first portion of the webinar will focus on general information about stress and trauma, as well as the impact of the pandemic. We'll review some of the ways that people commonly react to trauma, as well as the symptoms of PTSD. The second half is going to focus on PTSD treatment, including an overview of the leading evidence-based psychotherapies for PTSD. I'll also spend some time reviewing some public resources that are available to anyone. Please note that although I'm employed by the VA, today's presentation is not affiliated with this institution. However, I will be sharing resources available through the National Center for PTSD. And finally, the content discussed today is not intended to substitute a professional mental health diagnosis or treatment, should such care be warranted. The information is being shared to promote trauma awareness and education about PTSD as well as treatment options. I'll also touch on some general guidelines for seeking professional assistance. All right, so although stress and trauma are fairly common terms, they have certainly been used with much more frequency over the past 2.5 years since the onset of the pandemic. Therefore, I'd like to begin with just some basic definitions to ensure that we're all on the same page before moving forward. So a stressor is a challenging life event that typically results in stress or tension for the person. Stressors typically embody some degree of change, and they may require some attempts at coping in order to navigate the experience. Common examples include things such as the death of a loved one, job loss or fiscal stability, divorce, and chronic illness or injury. A traumatic stressor is a life experience that involves exposure to or threat of death, serious injury, or sexual violence. Traumatic stressors often negatively impact one's well-being and typically require a period of adjustment after the event. So common examples of trauma would include natural disasters, mass violence or combat exposure, interpersonal violence, including physical or sexual assault, and serious accidents. Post-traumatic stress disorder is a diagnosable mental health condition that may occur after a trauma. The trauma reactions become chronic and disruptive to the person's life. Mental health treatment is typically required in order to address these symptoms. So let's consider these issues kind of from the standpoint of the pandemic. Before jumping into potential traumatic stressors, I think it's important that we just kind of acknowledge the range of stressors that most people have experienced and their impact. So although there have been many positive developments over the past year or more with the vaccine rollout and society reopening, depending on one's personal or professional circumstances, many people may still be dealing with some different challenges as we transition out of the pandemic. So I've listed some of the most common transitional stressors on the slide. And when navigating these ongoing stressors, it's sometimes helpful to understand the nature of transitions and how people tend to respond to them. Transition naturally embodies change. Change naturally embodies some degree of uncertainty. Uncertainty typically results in stress. So even when change is expected and wanted, returning to in-person work or school, resuming travel and family holidays, it still often elicits some level of stress for the person going through the transition. All right. So survey data and emerging research over the past few years indicates that many people's mental health has been negatively impacted by these pandemic stressors. Some of the most commonly reported issues include symptoms of anxiety and depression, grief, burnout, insomnia, and increased alcohol use. I've included here 2 online resources that anyone can access that provide information regarding this issue. So the American Psychological Association, or APA, conducts an ongoing survey called Stress in America. Their most recent results were published in March, right at the 2-year anniversary of the pandemic. In this survey of approximately 3,000 adults, roughly 2/3 indicated that their lives have been changed forever due to the COVID pandemic. Approximately half reported that they were still unable to see some loved ones in person due to concerns about infection, and this number was closer to 60% for our essential workers. Almost 70% of the respondents noted that they've gone longer without seeing close friends and family due to COVID than ever before in their lives. The Census Bureau also conducts an ongoing survey regarding the mental health impact of the pandemic, the Household Pulse Survey. So their most recent results, which were published online in mid-July, indicated that of approximately 50,000 adults surveyed, 1 in 3 reported symptoms of anxiety or depression in the past 2 weeks. So the reason that I like to highlight this is that even as we continue to move forward from the pandemic, the multiple stressors and the chronic stress of the past 2 years is still impacting people in very real ways, which can make coping with ongoing stressors or new stressors that much more challenging. So there are some pandemic experiences that may be considered traumatic stressors. I've listed a few of them here, but this list is not exclusive. Some individuals have been exposed to COVID events that involve actual or potential death or serious injury. Trauma exposure may occur through direct experience. So the COVID-19 patient in a severe respiratory distress who feared they may die, or professionals repeatedly exposed to severely ill and dying COVID patients in the context of their job, such as our healthcare workers or first responders. Trauma exposure may also occur by witnessing in person or learning of an event, such as having a loved one with COVID-19 who experienced acute anxiety and fear that they may die in the midst of severe respiratory illness. Individuals who've had such experiences may be at increased risk of PTSD. There have been a handful of studies to date on the stressors listed here, and results indicate that some individuals have reported symptoms of post-traumatic stress linked to these stressors. All right, so now let's consider just how a person may react to a traumatic stressor. Trauma typically elicits a range of reactions, which I've listed here. Most people typically experience at least some of these reactions in the weeks or months following a traumatic stressor. So let's use the example of somebody who had a fairly serious car accident. Their car was totaled and they sustained some minor injuries. That person may feel really anxious and on edge for days or weeks following the accident. They may have difficulty sleeping and have a hard time focusing or paying attention to things. They may experience frequent unwanted thoughts and images of the accident, even though they're trying really hard not to think about it. The person may avoid driving for a while or even avoid being in vehicles because it reminds them of a car accident. And when they return to driving, that person may initially feel pretty fearful behind the wheel and experience physical reactions such as increased heart rate, sweaty palms, or muscle tension. These common reactions are not an indication of weakness or pathology. These are ordinary reactions to an extraordinary life event. Trauma by nature is unwanted, unexpected, and uncontrollable. Trauma is a big life experience that may result in big reactions that can impact a person across multiple domains, emotionally, cognitively, physically, and interpersonally. Now, trauma reactions are very similar to PTSD symptoms. PTSD typically develops when these trauma reactions become pervasive and disruptive to the person's day-to-day life. So I'll be expanding more on PTSD symptoms shortly. So research tells us that the most common response to trauma is resilience and recovery. After experiencing a traumatic stressor, even in the midst of those trauma reactions I just showed you, a natural recovery process begins taking place. Recovery is not instantaneous. It's a slow and gradual process that occurs as the person continues to navigate those trauma reactions and progress their life forward. The majority of people naturally recover from trauma on their own without any type of professional intervention and don't sustain any long-term difficulties or functional impairments. Research indicates that within the United States, roughly 60% of men and 50% of women will experience at least one traumatic stressor in their lifetime. However, only about 6% of US adults will experience PTSD at some point in their life. So our 6%, why do some people develop PTSD when others don't? Even if they experience the same type of trauma, and even in some circumstances where both people experienced the same traumatic event. So this is an issue that research has attempted to address for decades and continues to investigate. And research has indicated some factors that have been identified that may place a person at increased risk of developing PTSD. So the first thing that's important to keep in mind is that when we consider the potential impact of a trauma, it's not just about the event, what happened, but also about the person it happened to who experienced the event. So pre-trauma risk factors are aspects of one's personal history that may place them at increased risk of developing PTSD, such as already having a mental health condition such as depression at the time the trauma occurs. Trauma risk factors are specific aspects of the traumatic stressor itself. So, for example, certain types of trauma, sexual assault, combat exposure, are more commonly associated with PTSD. And third are our post-trauma risk factors. So these refer to certain circumstances or issues that occur after the trauma exposure. For example, research tells us that inadequate social support or negative social interactions, such as others blaming the survivor for the trauma or questioning the validity of the trauma, may increase the risk of PTSD. So one way to think about these risk factors are as barriers that get in the way of that natural recovery process. As previously noted, PTSD typically develops when trauma reactions become chronic and disruptive. These risk factors may serve as a roadblock on a person's path to recovery. Instead of being able to slowly but steadily progress through those trauma reactions and adjust accordingly, the individual essentially becomes stuck in that recovery process and is unable to move forward. Therefore, instead of those trauma reactions dissipating over time, they're maintained, and they essentially become the symptoms of PTSD. All right. So when considering post-traumatic stress disorder, we begin with returning to our definition of a traumatic stressor. It's important to remember that the experience of a trauma is our gatekeeper for this condition. PTSD develops after exposure to a traumatic stressor and the person developing a range of symptoms that are associated with that trauma. So there are essentially 4 types or categories of PTSD symptoms, which are listed here. And I'm going to go ahead and walk us through each one of those so you get a better sense of what those look like. All right, so our first category of PTSD symptoms is re-experiencing the trauma. So these really are essentially how the trauma continues to intrude on the person's current experiences. So unwanted thoughts and images of the trauma may be cued, meaning they occur when the person encounters something in their environment that reminds them of the trauma, or they may be uncued, meaning they just pop up out of the blue. With regards to the emotional and physiological reactivity when exposed to trauma reminders, these feelings and physical sensations often mimic what the person experienced at the time of the trauma, but with less intensity. In terms of the trauma reminders themselves, this may involve any range of sights, sounds, smells, people, places, objects, or activities that are associated with the trauma in some manner. So, for example, for an assault survivor, encountering a person with similar characteristics of the perpetrator, the same gender, age, race or ethnicity, the same hair color, eye color, physique, or tone of voice, any of these may serve as a trauma reminder and potentially trigger re-experiencing symptoms. Reexperiencing symptoms often result in the person feeling out of control, as if they're going crazy or losing their mind because they can't understand why they keep reliving aspects of the trauma when they're working so hard to try and move past it. Our second category of symptoms involves avoidance of trauma reminders. So avoidance occurs in two ways. There's the avoidance of internal reminders, so memories, thoughts, and feelings associated with the trauma, as well as external reminders, people, places, and things associated with the trauma. Avoidance is sometimes the best way an individual has learned how to cope with their PTSD symptoms. For many survivors, avoidance is the only way they know to try and keep those really distressing re-experienced symptoms at bay. Just stay away from anything that remotely reminds them of the traumatic experience. But avoidance is tricky. Avoidance is a very tricky symptom because it works in the short term, but it makes things worse in the long run. So if a person encounters a situation that stirs up a lot of anxiety, stopping by Target on their way home from work when it's really crowded, if they simply remove themselves from that situation, leave the store, their anxiety will immediately come down. Avoidance worked until the next time they find themselves in a similar situation with a crowd or a large group of people. That anxiety typically comes right back and even worse than it was before. So what many individuals with PTSD find is that if they use avoidance to reduce their anxiety gets stronger. It happens more frequently. It's more intense. It's occurring in more and more situations and with more and more things. As their avoidance gets worse, as their anxiety gets worse, they end up needing to use avoidance more and more as a way to keep that anxiety at a level that feels tolerable. Over time, the person's world becomes smaller and smaller because they're now avoiding so many things as a way of trying to manage that anxiety that just keeps growing. All right, our third set of symptoms centers around negative thoughts and feelings. Many people with PTSD simply find that they have more negative thoughts and feelings than they did before the trauma. And although fear and anxiety are often associated with a traumatic incident, PTSD can include a range of negative emotions, including sadness, guilt, and anger. A person with PTSD often finds that they view themselves and others very differently after a trauma, and sometimes in pretty extreme ways. So some common examples include having thoughts or beliefs such as, the trauma was all my fault, I'm incompetent, the world is completely dangerous, or no one can be trusted. In addition to these changes, some individuals struggle with a lack of emotion, just feeling numb or hollow inside, feeling disconnected or detached from others, even loved ones, and losing interest in activities or things that you used to enjoy are common symptoms as well. And then finally, our last category of PTSD symptoms center around increased arousal. So for many individuals with PTSD, they experience sort of a chronic sense of needing to be ready to react if something bad happens. So hypervigilance involves enhanced concerns for safety, and that typically results in the person feeling on guard or on edge much of the time. Examples of hypervigilance include constantly kind of scanning your environment for any signs of potential danger or threat, feeling unsafe or uncomfortable if people are standing behind you or too close to you. Sometimes in any given situation, almost having an escape route planned, knowing exactly where the exits are and exactly how you would get out of that situation if something bad happened. An exaggerated startle response just simply refers to kind of being jumpy or easily startled. This typically occurs in response to loud, unexpected noises, a door slamming, a car backfiring, but can also occur if suddenly surprised, like someone walks up behind you when you're not expecting it. This increased reactivity can also result in sleep difficulties, separate from nightmares, poor concentration and focus, as well as a shortened temper and irritability. All right. So my goal, or one of my goals in reviewing the symptoms of PTSD, was to hopefully validate and normalize what some people may have experienced following a trauma, whether it was related to the pandemic or a different life event. If these symptoms sound familiar and they're creating problems for you or for a loved one, I'd encourage you to please consider meeting with a mental health provider to discuss them. PTSD is assessed and diagnosed by a mental health professional, and there's a few reasons why working with a mental health professional is important. One, PTSD is not the only negative mental health outcome following a trauma. Trauma exposure has been associated with a range of mental health issues, including depression, anxiety, and substance misuse. Working with a provider who's trained in recognizing and assessing a full range of mental health conditions is important. Two, some symptoms of PTSD, like sleep disruption and poor concentration, are also symptoms of other mental health conditions. A mental health professional has the clinical knowledge and experience to be able to differentiate between these different diagnoses. And three, which as a clinician, I personally think is most important, diagnosis guides treatment. Your diagnosis is my roadmap in terms of what treatments are going to be most helpful for you. Therefore, an accurate diagnosis is essential in order to progress an effective treatment. All right, so I just want to pause briefly and check in to see if there's any questions I can address or anything I can clarify based on what we've discussed so far.
This has been so great, Dr. Keys. Thank you so much. We did have a question from April. Could high ACEs increase the risks of PTSD, or does it only come about with traumatic stressors?
So I would say that that's an area where they're still really learning what to clarify and define as a trauma. That definition of a traumatic stressor, especially when we're looking at diagnosing PTSD, when we're looking at like our DSM manual that we use to diagnose, that definition of a traumatic stressor has been tweaked and changed over the years as it kind of accommodates new research that's coming out. So I would say that's something that continues to evolve over time. I really do anticipate that given the pandemic and what a huge impact it has had on mental health, especially with it being such a chronic event that people have just had to deal with for years on end, is going to probably really contribute to redefining the definition of trauma as we go forward and as that DSM manual gets updated every so often.
And just to let our guests know, feel free to put any questions or thoughts in the chat and we can answer them now, or we can get them at the end of the program as well. Dr. Keys, I'm curious, you said 1 in 3 Americans are dealing with anxiety and depression. That's a lot of people. That, I mean, when I think about a third of the people I meet on a daily basis are dealing with something pretty serious.
It is. And the part that's, I won't say alarming, but the part that kind of put that in context is back at the height of the pandemic. So when we were looking more into like, fall and winter of 20, moving into early 21, that survey, and you can find, if you go to that link, you can scroll through that survey and find the results all the way back to right after the pandemic started. That number was closer to like in the 50-something percentiles. So it's actually dropped since the height of the pandemic. But no, it really speaks to, even as we're 2.5 years into this thing, the degree to which the mental health impact for some folks is still very, very resident and still very real. It's not something that people have been able to navigate or move through just yet.
And Eddie has asked, how do you recognize the mental health effects of COVID and treat PTSD while also recognizing the very real physical effects of COVID that it has on our most vulnerable populations, elderly and disabled?
So I would say that in terms of, and we do know that there are some populations and cohorts of individuals where that mental health impact is probably more severe simply because the risk of COVID, the risk of infection, how many of the pandemic changes and safety measures impacted them, impacted some groups of individuals more than others and in different ways. So I think that's a good point, Eddie, that a lot really does depend on when we talk about the mental health impact of COVID. The research indicates most people have been impacted. We absolutely have groups that have been impacted more so and in more ways. And that also can absolutely have a mental health impact where we may see certain groups that have higher rates of mental health issues.
And we also have a question about where could one go in 48 hours in St. Louis County to get diagnosed and obtain a treatment plan. How easy is it to get treatment? How easy is it to get the help that for someone who might need something immediately?
So I'm going to, at the end of this, when we go through resources, I'm going to point you in the direction of a few different resources that can help you locate a mental health provider or a therapist. So there are some resources available for that. In terms of how quickly you can get access or how quickly you could develop a treatment plan, there's many variables at play, including insurance costs, accessibility, that type of thing. I also am going to highlight, which if this is somebody who's feeling like they really need to speak to somebody quickly, I'm also going to highlight a crisis line that's kind of a 24/7 confidential resource that if you do feel that you are in a heightened state of emotional stress, there's always somebody there, a trained mental health professional you could reach out and talk to. So I'll highlight that at the end when we go through seeking professional assistance. Okay. All right. Are we good to go ahead?
That is wonderful. Thank you so much.
All right. Well, I'm going to
yes.
Okay. Okay. All right. So just kind of coming back to the second half of the presentation, when thinking about treatment, it's sometimes helpful to begin with understanding why treatment is important. So a really common question that comes up a lot of times is, why should I consider treatment if I've been living with PTSD for a while now and I'm getting by? So treatment is worth considering because there's really no need to live with the unwanted consequences that PTSD has on your life. Research has told us that PTSD negatively impacts one's relationships, work and school performance, and physical health, all of which contribute to diminished quality of life. Effective treatments for PTSD are available. In many cases, treatment results in symptoms being reduced. They're occurring less frequently and with less intensity, if not eliminated. In addition to symptom reduction, many individuals find that treatment enhances their interpersonal relationships and enhances their quality of life. Also, some PTSD treatments involve learning a set of skills that are not only used to address the PTSD symptoms, but can be used to navigate struggles in real life. These skills can be applied to new stressors, difficult situations or decisions, and in troubled times. So treatment isn't just about gaining symptom relief, but can also be about acquiring a helpful skill set that you can use going forward. So one way to think about treatment is that choosing to engage in treatment creates a new opportunity for recovery. It's putting yourself back on that path of recovery that was disrupted for whatever reason or by whatever barrier. Now, instead of a recovery occurring through a natural process, recovery occurs through the treatment process. All right. So when a term that you may stumble across if you're investigating treatment options is evidence-based or empirically supported. So evidence-based treatment, or sometimes more broadly referred to as evidence-based practice, refers to treatment that is backed by science. Extensive research studies have been conducted to ensure the treatment is effective. The effectiveness of the treatment is objectively evaluated to reduce any prejudice or bias. And many of these studies are published in peer-reviewed scientific journals, which means there's a group of experts that carefully review that study to ensure that it was well-designed, correctly implemented, and that those results are reliable and valid before distributing those results to the field through publication. With regards to PTSD, there are two types of treatment that have the most scientific evidence supporting their effectiveness: psychotherapy or talk therapy and medication. So for our purposes today, I'll be focusing on psychotherapy treatment options, but the link that I've included here under medication will point you in the direction of some materials that talk about using medication to treat PTSD, including what medications have been found to be the most effective or the most helpful. All right, so before we jump into talking about specific psychotherapies, I just want to talk a little more generally about treatment and kind of what to expect. Trauma-focused psychotherapies are the most highly recommended type of treatment for PTSD, as they've been found to be the most effective, even more effective than medication. Trauma-focused simply means that the therapy is going to focus on your memory of the trauma or the meaning of the trauma, how you've kind of understood it or made sense of it over the years. These therapies explore different thoughts, emotions, and behaviors that have become challenging or difficult for you since the trauma. They use different methods to help you process the trauma and gain a better understanding of how it's impacted your life. All right, so listed here are the three leading trauma-focused psychotherapies that, again, have the strongest scientific evidence supporting them: prolonged exposure therapy, cognitive processing therapy, and eye movement desensitization and reprocessing. So we'll review each one of these so that you have a sense of kind of how they differ. But I'd first like to highlight just some commonalities across all three psychotherapies. So these are individual psychotherapies, meaning you'd be meeting one-on-one with a therapist. The only exception is cognitive processing therapy, which can also be conducted in a group format. So you would be progressing therapy probably with a few other individuals with PTSD and going to weekly group sessions. All of these are time-limited treatments. They involve weekly sessions, typically for about 3 to 4 months. A potential risk of trauma-focused therapy is some level of discomfort when approaching those trauma reminders you typically avoid, like thinking or talking about the trauma memory or approaching situations and activities in real life that you try to stay away from. This discomfort is typically short-term, and most people report that they start to feel better as therapy progresses. And finally, PE and CPT involve daily homework that you'll progress in between your therapy sessions. So as noted, some psychotherapies involve learning skills that help you address the PTSD symptoms. And these skills are like any other skill. They require practice in order to become proficient in them and fully benefit from them. Also, as I often tell many clients, PTSD doesn't just affect you when you're here with me for our therapy session. Where PTSD is impacting you the most is out there in your day-to-day life. Therefore, learning how to use these skills outside of therapy in your daily life is where they're going to benefit you the most. All right. So as we walk through these different treatments, the one thing I just want to highlight is at the bottom of each of these slides, I have 2 resources from the National Center for PTSD. One is an article that gives you more detailed information about the therapy, and the other is a brief video. They're all about 10 minutes or less that just does a wonderful overview kind of the treatment and how it works. All right, so our first trauma-focused psychotherapy is called prolonged exposure therapy, or PE. The goal of PE is to help a person approach trauma reminders they typically avoid in a safe way, so that their distress decreases and they learn that these reminders are not dangerous. Thus, there's no reason or need to continue to avoid them. This is accomplished through 2 types of exposure techniques. Imaginal exposure is visualizing the trauma memory in your mind and then narrating the details of that memory out loud during the therapy session. You typically do this multiple times and then discuss that experience with your therapist. Imaginal exposure is recorded, and then you'll listen to that audio recording every day as part of your homework. Imaginal exposure helps you gain better control of your thoughts and feelings about the trauma. Our second exposure technique is called in vivo exposure, and this is gradually approaching those trauma reminders in real life, including places, people, and activities that you typically avoid. So you and your therapist will work together to come up with a list of 10, 12, 15 items. And then each week you'll decide together which 2 or 3 things you'd like to progress as part of your daily practice. In vivo exposure really helps you reclaim many aspects of your life that have kind of fallen by the wayside due to avoidance. These exposure techniques, both imaginal exposure and in vivo exposure, create a new opportunity for learning. Namely, learning that the trauma reminders, including the trauma memory, are not the same as the trauma itself. P helps you learn that you can handle yourself in these difficult situations, even if they feel scary at first, that your distress and anxiety will come down by approaching as opposed to avoiding these reminders, and that many of the things that you avoid due to fears that they may be dangerous are in fact mostly safe. If it was safe to go to a crowded store on your way home from work before the trauma, it's probably still pretty safe to go to a crowded store after your trauma. Our second trauma-focused therapy is called cognitive processing therapy, or CPT. So the goal of CPT is to help the person change many of the unhelpful, negative thoughts and beliefs they've experienced since the trauma. Since trauma is typically an overwhelming experience that falls far outside the range of normal life events that anyone would anticipate, it often disrupts a person's most basic beliefs about themselves, others, and the world. Trauma results in extreme thoughts. The world is completely dangerous. And extreme thoughts result in extreme emotions, typically really strong, intense feelings of fear, sadness, or guilt. CPT helps you learn skills to change the way you think, which also changes the way you feel. So CPT involves exploring the meaning of the trauma by initially writing about and discussing in session why you think the trauma occurred and how the trauma changed your views of yourself, others, and the world. Over the course of therapy, you'll learn a set of skills that help you identify these unhelpful thoughts when they occur, how to challenge these thoughts to determine if they're accurate or inaccurate due to the PTSD, and most importantly, how to develop more balanced, helpful thoughts that result in less negative emotions. This particular therapy utilizes a lot of worksheets, both in session so that you can learn the skill, and then outside of session as part of your homework, so you can practice those skills in your day-to-day life. Now, there's also a version of CPT that involves writing about the details of your trauma memory. You then read this written narrative in session and kind of discuss the experience with your therapist. This is an optional component of treatment, and this is something that you and your therapist could decide together whether or not this is something you'd like to include. All right, and then finally, our third trauma-focused psychotherapy is eye movement desensitization and reprocessing, or EMDR. So the goal of EMDR is to help a person process distressing memories, thoughts, emotions, and bodily sensations associated with the trauma. Processing these internal experiences related to the trauma typically results in decreased distress and ultimately thinking and feeling about the trauma in a new way. So this processing takes place in session. There's no homework or between session practice with EMDR. During your therapy session, you'll think about the trauma memory, kind of picture it in your mind, as well as any upsetting thoughts, words, emotions, or physical sensations that tend to accompany that memory. While holding that kind of mental image in your mind, you'll focus on a repetitive movement or repetitive sound, such as your therapist's fingers moving back and forth or a beeping tone. You'll do this multiple times in session for short intervals, interspersed with pausing to discuss the experience with your therapist. Over time, how you experience that memory will start to change as that distress decreases and you're able to process more information. Oftentimes just details that you haven't really had a chance to think about because there were such intense, overwhelming emotions accompanying that memory. You and your therapist will discuss the meaning of the trauma and new ways of thinking about it. Once that memory becomes much less upsetting, you'll then attempt to pair a more positive or a different thought or feeling with that trauma memory. And oftentimes it's a new perspective, such as, I survived, or it's in the past. So again, when thinking about potentially engaging in treatment, a really common issue that comes up for a lot of people is, how do I know? How do I know if I need treatment? How do I know if I need professional assistance? So what I want to talk about right now are just some potential indicators to keep in mind regarding whatever changes or symptoms you may be experiencing, whether it's related to trauma or some other issue or life event. So if the changes or symptoms are occurring more often than not for an extended period of time, and our general rule of thumb is a couple months, if those symptoms feel unmanageable, out of control, or are causing a source of conflict in your significant relationships, if those changes interfere or prevent you from doing what you need to do, sleep, eating, work, school, or if they're interfering with what you want to do, spending time with family and friends, recreating, things that you enjoy and that you're interested in. Essentially, if they start disrupting your functioning. And then finally, if any of the symptoms or changes embody safety concerns, thoughts of hurting yourself or others, frequent thoughts of death, vague, better off dead feelings. And these are all indications that seeking professional assistance from a mental health provider may be helpful, at least for an evaluation to determine what's going on. And please keep in mind, there are many time-limited evidence-based treatments for a range of mental health conditions, including depression, anxiety, prolonged grief, and insomnia. So when seeking a mental health provider, it can sometimes be confusing just due to the range of mental health professionals that offer services. So this link here from the National Center for PTSD just provides kind of a general description of the different types of mental health professionals based on their education and training. When seeking a therapist, this resource from Psychology Today is very user-friendly. It allows you to search a range of mental health clinicians in your area, be it by city or zip code, based on the type of provider you're seeking, the type of treatment you're seeking, and based on if you have insurance, who accepts that type of insurance. And then finally, I always want to ensure people have access to a crisis line if needed. The 988 Suicide and Crisis Lifeline is a 24/7 confidential resource for individuals in emotional distress or crisis, or with a loved one in crisis. And their website provides a wide range of resources as well. So I always encourage folks to please just consider adding this number and website to the contact list in your phone, just to ensure you have it at your fingertips if you ever need it or want it for yourself or someone else. All right, so now I just want to spend a few minutes kind of reviewing resources so you kind of have a sense of what I'm giving you. So for all of the content that I've presented today, I tried to use resources in the public domain so that anybody could follow up on them if they wanted to. So all the references are listed at the end of this presentation, but we will have a Word document available with those references that will be posted on the website. And also all of the resources that I've covered throughout the presentation will also have a second Word document that just lists those resources. So that may be a little easier to navigate than having to sort through a bunch of slides. So this book is one of the key resources that I used for today's content. It's written by two internationally recognized experts in the field, Dr. Barbara Rothbaum and Dr. Sheila Ralph, who are both faculty at the Emory University School of Medicine. This book is written in a really helpful question and answer format, where the authors address just some of the most common issues and questions about PTSD. The information presented is based on scientific research, but relayed in a very clear, concise language. So I've been reading PTSD books for 25 years, and this is truly one of my favorites. It was just published in 2020, and I highly recommend it if you're a trauma survivor or have a loved one with PTSD, as a mental health professional, or if this is just simply a topic you're wanting to learn more about. I think this can be an incredibly beneficial and useful resource. All right, so I've already provided links to some resources from the National Center for PTSD, but I want to highlight a few more. So it's important to note that although the National Center for PTSD is part of the VA, the resources available are not just for veterans who experience military trauma. Many of the resources are developed for survivors who experienced a range of trauma, as well as professionals who work with civilian and veteran survivors who have PTSD. So for the first top of this regarding public resources, National Center for PTSD has developed several mobile apps that are free and available to anyone. They work on both Android and iOS platforms. Now, some of these apps are associated with specific PTSD treatments like PE or CPT, and you'd actually use that app while you were in therapy, but other apps are geared towards self-help. They contain a range of self-help tools to help enhance emotional well-being. They have a mindfulness app as well as a COVID-19 app that they developed shortly after the start of the pandemic. It includes science-based coping skills to help you deal with or manage a range of issues that may have occurred as a result of the pandemic. Sleep difficulties, anxiety, sadness, interpersonal difficulties. So the mobile apps can be a really, really great resource to get your hands on. I also included a link for individuals who have a family member or friend with PTSD. So this will point you in the direction of materials that will provide guidelines on how to help support your loved one with PTSD, as well as suggestions on how to support yourself while you're supporting your loved one. The bottom half of the slide is geared towards any of our mental health professionals who are watching today. So just be aware, the website offers numerous free educational webinars and online courses, many of which are available for continuing education. The National Center for PTSD has a national consultation program, and it provides free consultation services for community providers working with veterans with PTSD. But in light of the pandemic, they've expanded their services, and they now offer free consultation to community providers working with anyone, civilian or veteran, who is struggling with mental health issues due to the pandemic. If you jump onto that website, there's just a simple request that you put in via email, briefly explain what the issue is that you'd like some feedback on, and they will seek to match you with one of their experts who specializes in that area. All right, just a few additional resources from the International Society of Traumatic Stress Studies, which is a professional organization for folks who work in the trauma field, but they do have some resources available for non-members. Some are geared towards the public, some are geared towards professionals. And then finally, even though today's webinar really was geared towards adult trauma survivors, because I'm an adult clinical psychologist, I don't work with kids, I definitely wanted to point you in the direction of the National Child Traumatic Stress Network. This is a great organization that offers a range of public resources for the general public as well as professionals that are all related to childhood trauma and PTSD. All right, there's my contact information if needed for any reason. And finally, just a few take-home points that I hope that you will leave with today. So kind of circling back to my opening statement, I know that trauma and PTSD are sometimes a heavy and tough topic to discuss. One of my biggest goals with the content we presented today was that this hopefully instilled a sense of hope regarding the possibility of recovery. If you're living with PTSD or have a loved one living with PTSD or suspect you have PTSD, just please be aware that there are effective treatments out there, and it's never too late to put yourself back on that path to recovery that was disrupted for you for whatever reason. All right, so that concludes our content. I'm going to go ahead and shut down the slides, and then we can open it up for these last few minutes for questions.
Wonderful. Thank you so much, Dr. Keys. One question that we received is, what if the trauma isn't directly experienced or seen, but for instance, we're watching trauma happening on television, like mass shootings, more and more and more. Can it be something you don't directly experience?
At this point in time, based on the definition of a traumatic stressor when we're diagnosing PTSD, it can be something that you witness in person, or it can be, like we said, in some cases where people, based on their profession, they're just constantly exposed to the details of trauma that others have experienced. But I would say, and I do think this is sometimes one of the reasons why meeting with a mental health professional can be helpful, is that, we have an entire category of trauma and stressor related disorders. So PTSD is not the only kind of outcome of experienced trauma or experiencing stressful life events. There are several others for this exact type of thing. Do you have somebody experience something that may not exactly be defined as a trauma, but it most certainly has impacted them in some way? It's so worth meeting with a mental health provider to determine, has this developed into clinical symptoms and what type of treatments might be available.
And we also had a question about psychedelics and their use in treatment.
Yes, I thought that may come up because there's been so much attention around that. So yeah, so I can give you kind of generally the idea around this. So over the past several years, one of the areas that trauma research has gone is they're using psychedelics. A lot of the research is centered around MDMA, with the street name would be ecstasy or Molly. And what they've been found so far on the emerging studies is they typically are using pharmaceutical grade MDMA, not what you get off the street, pharmaceutical grade, to assist in psychotherapy, and they're finding positive results. So I can give you the names. I actually jotted these down because I thought this question may come up. I can give you the names of a couple organizations that I can direct you to that will have more information about this. So one is called the Center for Psychedelic Psychotherapy and Trauma Research, and it's at the Mount Sinai School of Medicine in New York. That's one that's doing a lot of research in this area. The other, the acronym is MAPS, and it stands for the Multidisciplinary Association of Psychedelic Studies. It's based out of San Jose, California. But those are two websites that I can point you in the direction of that will have a lot of information and share some of the research and findings if that's something you're interested in.
Great. Yes, and we had a question about people's self-awareness of their own trauma, how they handle it when they are diagnosed. Are there common behaviors that you see when someone is surprised by a diagnosis of PTSD?
I've seen a range. I've seen some folks who there's almost a sense of relief that now there's a name for what they've been going for and kind of a reason as to why they've been having all these experiences they couldn't understand. But I've also had some individuals where, depending on the nature of the trauma, and I'll give you one example of some clients I've worked with over the years who experienced childhood sexual abuse. They may not necessarily have viewed that as traumatic, even though it certainly impacted them and they had significant symptoms. Depending on the age that they started and the nature of it, they may not have necessarily viewed that as a trauma. They may not have necessarily viewed it as abuse. So there's so much variability there in terms of how people react, depending on the nature of the trauma and just how it's been impacting them.
Well, I am so glad that you're there to take care of those folks. That is so wonderful. We have this question. Could you speak further to diagnosing and treating trauma-based disorders as it relates to complex trauma? PTSD seems not as geared toward many ongoing traumatic stressors as much as a few identifiable events.
Yeah, and so complex trauma is a type of trauma that often occurs when people have experienced repetitive and kind of continuous, often interpersonal trauma, starting typically in childhood. But the key to this is really that it's interpersonal trauma that was repetitive and ongoing and fairly severe. And it can result in complex trauma. And complex trauma embodies not just kind of our PTSD symptoms that we've covered, but it also can embody a lot of difficulties and challenges interpersonally. So there are some treatments for it. I agree that you don't tend to see as much of it as you don't tend to see it in the media as much as you see just PTSD, but there's more and more treatments coming out for it. There's more information on it. I'm blanking on the name of I don't want to Google it because I'll mess up the thing. I'm blanking on the name of the expert that I'm thinking in this field, but I'll try to dump it in the chat box at the very end if I think of it, who's done a lot of work on this and talks about treating complex trauma.
And we've had so many of our guests send you many thanks for this incredible information.
I'm glad.
And just to let you know that we are going to post the resources that Dr. Keys has provided on our website. And also you can watch this video again on our website and on our YouTube channel. So those links are there too, because we don't want you to miss out on all the great information. And just one quick last question.
Yeah.
Do you know how COVID-19 and PTSD have affected adolescents? Are you aware of any resources specifically for adolescents? This person works for the Adolescent Health Initiative, and they're always looking for resources.
For adolescents, I would still, I'm thinking from a diagnostic perspective. So from a diagnostic perspective with adolescents, we'd still be looking at kind of the adult criteria for PTSD because it's for people 6 and older. As far as specific adolescents, I would check out that National Child Traumatic Stress Network because they have a lot geared in there towards family and kind of the full spectrum of basically non-adults. So I would probably try that as your best bet. I don't know anyone, since I don't work with kids or adolescents, I can't point you in the direction of any specific that field, but I would check out the National Child Traumatic Stress Network website to see what they have.
Well, Dr. Keys, this has been so wonderful. I wish we could keep going, but we're out of time. Thank you for sharing your insights with us and all this wonderful information. And I want to thank all of our guests too for spending this time with us. You're the reason that we do this. So we are so grateful that you're here. We're so grateful for your questions and comments. A big thank you to my Brown School colleagues here, especially Dale, who has saved the day many times in the last hour. Now, if you missed some parts of the program or you want to see the resources that Dr. Keys has provided, I put in the chat a Brown School YouTube channel link and also an Open Classroom link that will have the video and also the resources. So you can get all that information there and give us a little bit of time, maybe up to 72 hours to get those posted, but we'll get those for you. And I guess that we are just going to say thank you so much, Dr. Keys, for the work you do and the knowledge you've shared. We really appreciate it. And we hope that we'll get to see you next time on Open Classroom. Have a good day. Bye-bye.
Thank you so much, everyone, for joining us. Thank you again.